Hello, my name is Dr. Gasca, and this video is to better help you understand the pre-surgical instructions about your upcoming dental procedure or dental surgery. I'm a big believer that transparency is very important, and I think giving you more information and details to better understand the aspects, the ins and outs of the healing process that you would go through as a patient with me are extremely important. I like details. Details are really important as well to make sure that everything matters about how we get the best outcome and the best healing going for you as a patient. This may be different than prior dental procedures that you've had with other providers. I'm a big believer by looking at all the details all together, we will get a better and more, again, predictable outcome. Let's get started. The pre-surgical instructions. First, starting off with swelling and bruising. Swelling and bruising is very important to understand that it is just a normal reaction to most of our procedures. I expect most patients will have an element of swelling and bruising that peaks at day 3 and day 4, and that continues on into that end of that first week. But normally by 1 week, most patients feel that they have very minimal the swelling still left. Depending on the procedure we do, if it's a gum grafting procedure, there will be a lot of swelling and bruising that's going to be visible on somebody's face. It's just normal. Normal healing is happening. However, just to keep in mind, from the scheduling perspective, from making sure your social calendar lines up with this dental procedure, I'd rather not do any bigger procedure prior to something very important in your life. That is a critical thing. Discomfort. Discomfort is something that we have to factor into any dental procedure, regardless if it's something small or something large. There's going to be a level of discomfort and just kind of an uncomfortable nature to any procedure that we do. Depending on the procedure, that may allow patients to feel a lot more uncomfortable, needing more management via medications. I do expect a patient typically to be in the 80 to 85th percentile of how they regularly feel the day following the procedure, which means a patient should be able to work the next day from a procedural standpoint, as long as consider that the swelling and bruising is not going to affect your day-to-day interaction with different people. But the discomfort level should typically be manageable with medication. What I recommend typically is having patients take over-the-counter medications, every 3 hours alternating between an ibuprofen and an extra-strength Tylenol, back to ibuprofen to extra-strength Tylenol. Repeating that process is needed throughout the first 3 to 4 days after every procedure. That is a critical element to keep patients at the 80 to 85% of how they feel level the day following the procedure. Now, sometimes it is the case that patients are a little bit more uncomfortable and need something a little bit stronger mixed in to their regimen for medications. So what we recommend and what we provide is a narcotic medication, typically Tylenol 3, a tramadol, or Norco, something of this sort. Please refer to your assistant to get this information. But as we provide that for you, that could be altered into the regimen that you have every 3 hours, along with the ibuprofen. We will instruct you more about how to do this, but again, the goal is not to necessarily take any narcotic medication. It is to have you prepared in case you do need to, or we are at that point where the benefit outweighs the risk of taking something. That is the goal. But always keep in mind, keeping you comfortable is a big priority for us here. We want to make sure you have the best experience possible, but we do need to partner with patients to make sure that they do take the medication as appropriate. The diet. The diet is the #1 reported problem and complaint that we have via any procedure. It's a pain in the butt. The reality of it is we like most of our procedures to go with a soft, cool food diet. Let me describe. When I say soft, I'm looking for scrambled eggs texture or softer for the first 2 weeks. The first week's going to be more strict than the second. We will provide instructions about those changes, but the realistic goal that we have is to be as gentle as possible with the procedure, not interacting with the surgery site with anything that's at all hard. So scrambled eggs is kind of the definition of a soft food. So we're looking at things like puddings, yogurts, smoothies, soups. Those are all things that would qualify under a soft diet. We like to keep the temperature room temperature to cool to ensure that patients know that it won't affect them from a temperature and discomfort level, or won't raise the level of discomfort that they're having if something is a little too hot. Also, spicy foods are out. So all those things I know are not a typical routine that anybody has. So I know it's a bummer that is a part of our process. However, Super important to send you through a procedure looking to get the 99th percentile for success, and that predictability really comes with following those rules the best you can up front. Short-term sacrifice for the diet leads to long-term gain for better healing. Thank you. The fourth thing on our list that is not written down but needs to be described is always the amount of limit to your physical activity. Everybody's physical endurance is different, everybody's athletic abilities are different, everybody's hobbies are different. We really want to make sure that we're on the same routine and same page for keeping your heart rate down after the appointment. We always recommend 5 to 7 days of no physical activity. Walking is just fine if you're walking a dog or an animal, or just with friends. That is just fine for as long as you like, as long as you keep your heart rate down and you're not walking up a mountain or walking for pace. But other than that, there's always things to be mindful of. No exertive activities, no weightlifting, absolutely no swimming. There's a lot of things that could really throw our procedure off from the normal healing. We want to make sure to be mindful of that. If there's any specific questions, please ask myself or my assistants to make sure we're on the same page before moving forward. Lastly, no surprises. At the bottom of the sheet, it seems sarcastic, but I think it's extremely important to know. I don't like surprises. Surprises are for birthdays, not for dentistry. We do try to bring all that transparency and detail to patients prior to coming in for their appointment to make sure that you're better understanding what to do, what not to do, so then you can pick the right timing on the calendar for your appointment to make sure we can get a great outcome. Thank you for watching this video, and I look forward to seeing you for your first appointment.